2021. You can see my still rooting for those Sox. Hopefully, going to go down to a Sox game, the last one on Sunday. Hopefully, everything works out. And keep calm and trust God. Coffee cup, and we're going to be talking about something that's very important and out there. We're with a friend here, Jan Guider, and we're going to bring her up right now. And Jan is the CEO of Equity and Health Advisors Network, and she's does a lot of different things. This lady, she's really involved in the community, and so we welcome Jan, and she's on the DuPage Health Board. We're going to get outside of King County right now, Jan. We're going to get into DuPage. We're going to do DuPage, and she's, like we said, she's the CEO of Equity and Health Advisors, and she's a public health consultant that works tirelessly in creating relevant COVID-19 education, and she's and increasing the vaccine access and reducing the overall hesitancy that and disparities we have in our community. And so we're going to be discussing some of those things here, and then we got a little extra. We're going to talk about a walk too a little later in our conversation. So we got a lot of things to touch base with. Jan, good to see you.
Well, John, it's good being back here. How are you?
Well, like I said, my pretty little time together, I got a little tooth problem, but that's something else. And then we're doing a clean out. We're doing a downsize here. We're going to have some friends over tomorrow on a big clean out. So that's the kind of stuff. And then, as I mentioned, hopefully going down to see the White Sox in their last game of the year. Uh, so, like I said, we're going to discuss resistance, I should say. Resistance, our community of colors, and health equity, and later the breast cancer awareness over at Kentucky. Uh, Jan, what's happening there in DuPage in the area about vaccinations, and especially in the communities of color? What's the story there right now?
Well, I'm very happy to report that well over 63% of DuPage residents who are qualified to get the vaccine are fully vaccinated. We have 80% who are eligible and have received at least one COVID-19 vaccine dose. So we're slowly moving the needle. We still are having some hesitancy, and at this point, I'm not going to call it hesitancy, but resistance amongst members of our minority population. And that's not without understanding because historically, especially with African Americans, there is this built up distrust of the medical community for causing some resistance to accepting the science, to accepting the government's role in the vaccine rollout, and particularly of interest lately is the increasing number of mandates. And I read something earlier today. I would like to read it and share it with your audience, John.
Yes, go
And
right ahead.
okay, when we talk about the role of the government, and this is a quote from a man who, not like many of us, is not perfect or was not perfect. But when I read this, I thought this perfectly explains the role of our government. And the quote is: the care of human life and happiness, and not their destruction, is the first and only legitimate object of good government. And that was Thomas Jefferson who said that in speaking to the Republicans of Washington County, Maryland, in March 1809. And that has not changed.
No.
I get it. I do understand why there is some resistance. Some of it is tied to historical maltreatment. But the reality is, and this is something that I repeatedly say to minority people who unfortunately are at greater risk for what we call severe disease, as well as even for contracting COVID. Uh, get the vaccine. What, even though we have reached that 700,000 deaths
Yes,
point
right.
in our country, which is a tragedy in and of itself, because this, in my opinion, could have been avoided. I knew
Right.
people had to die, but not 700,000. That's close to 1 million people. And
Yes.
John, I often ask myself, when did we as a society come to a point where we can normalize that number of our fellow citizens dying without feeling burdened by this and wanting to find a way to mitigate the disease and correct what's happening? Because keep in mind, those 700,000 people, a lot of them were parents. A lot of them have left behind young children. Some of the older people who have died have left behind grandchildren and children. So there's a human side to this story. There's a human need for us to all become more proactive and more responsive to a public health, and it still is an emergency.
Well, that's very true. And people of color are proportionately more frontline workers too. And that's so they're vulnerable to getting the COVID. Healthcare, stores, public service. You can go down the list. Are just right in the front line there, and there's no reason. I was just looking it up, Jan, a little before. There's a nice article from John Hopkins that talks about this, and I think one of the leaders in the research on this COVID-19, what do we call it, RM. What's that?
Are we talking about the vaccine MR?
Yeah, the vaccine.
Yes, the MR. Well, let me get this right. I hate to misquote things. I want to say the MRJ, but let me just make sure.
Yeah. Well, anyway, that development of those vaccines like Pfizer and Moderna were led by an African American lady.
Oh yes, out of the CDC. You talking about the mRNA vaccine?
Yeah, that's what I'm talking about. Yeah, yeah.
Yes, yes.
So, you know, I know this hesitancy is from that Tuskegee stuff, and there's other things too like that. That's sad that those things happened, and the government did some bad stuff back in the 50s and 40s, and my uncle told me a story. It wasn't quite like that, but how the government dropped, I think it was swine flu virus on some herds of animals and didn't tell the people in Florida. And then that was in the 50s. So these type of government doing stuff without telling is not, it's happened, but we know that this is not that way.
But John, if I might say this, because I don't think that it's just what the government did 30, 40, 50, 60 years ago, a century ago. I
Right.
think it's what continues to happen
Right.
that
No, yeah.
that causes a lot of distrust in
Right.
especially African American communities. For
Right.
example, in our country, an African American Black mother will die from childbirth at a disproportionately higher rate than white women. This
Okay.
month, we are observing the National Breast Cancer Month, okay, observation. And while Black women do not contract or are not diagnosed, rather, with breast cancer at a higher rate than white women. We are, however, more likely to die. In fact, we die disproportionately at a higher rate from breast cancer than any other population. So it's not just what historically happened, it's what continues to happen. And this is what I'm working to change. This is what I'm joining hands with other organizations, and why I actually named my company Equity in Health, because
Okay.
that's our single focus, is to have equity in health. And we cannot do that if we don't acknowledge that there really is a problem, and we've got to begin to work on mitigating the inequity, so that when I walk into a physician's office as a Black woman, I am not standing there or sitting there wondering, what is this physician thinking about me? How is he labeling me? How is my care affected by my race? Or even because obesity is more prevalent in our community, has this physician made some opinion of me because I'm either older Black woman or a younger Black woman who's obese? This is a burden that has been on Black people for a very, very long time. And one of the reasons, when I hear people say, "Oh, get your vaccine," or wear your mask or whatever, because we want to go back to normal. I don't want to go back to normal.
Oh, okay.
Okay, if
I hear
anything,
what
this
you're saying.
right, if anything, this contagion, a SARS-CoV-2
Right.
virus, has showed us as a nation, as a world, that normal was not working for African Americans. Normal was not good for Latinx people. Normal was not good for our elderly people. Normal was not good even for a lot of our Asian communities and our indigenous Americans. Normal wasn't good for us. So to say we just want to go back to normal, it makes me wonder why. I don't want to go back to normal. But this is the thing, we're at an impasse.
Yeah.
Okay, we are at an impasse because we have people, rightfully so. I'm not judging anyone who says I'm not getting the vaccine. We have people who, because of the history, are very resistant to doing anything that the government says we need to do. But this is that one time, and let me not limit that to that one time. This is an important time for us to listen up and recognize. We had two young mothers to die, whose children, they believe, I'm trying to remember the name of the school. It's on the west side of Jensen. Wasn't that the name of the school, Jensen? Two young mothers, beautiful young Black women, who died just in the last week or so.
Where was this at?
Because Jensen Grammar School, I believe, is in Chicago.
Oh, okay. Okay.
These two young mothers, they look like they might be in their 30s or 40s from the photographs that I saw, died from COVID. They didn't have to. Neither one was vaccinated. The vaccine is not 100%,
No.
but our studies are showing those who are vaccinated and who have breakthroughs, meaning they still contract COVID, they are less likely to experience severe disease. This is, at this point, I want to say this, we are trying to not just mitigate the disease, but we are trying to avoid severe disease, ultimately death.
Right.
So the vaccine in that regard will help you. And John, if I might say, I think we both come out of a background where we grew up understanding, believing that we have a responsibility to our brethren. Okay. It's not just about me. It's not just about you, John. It's not just about one person. This is about my role. This is about what I can do to help my community get healthy. We all have to look at this as we're in this thing together and make it work.
You're correct on that so much. And I just want to digress 1 minute when you were talking about, oh, let's go back to, you said normal, whatever. I remember, maybe you've heard of this evangelical African American preacher, writer, John Perkins. I remember he came up to Aurora and I don't know, somebody said something like that. We want to go back to the way it was in the Constitution. And he said, hey, I don't want to go back to being 3/5 of a man. And I go, yeah, that kind of nostalgia stuff is, I don't know, it's just malarkey. We got to get beyond that. We got to get to the Christian point of view, and that's what we're trying to do. And I know that's what you're trying to do. That love your neighbor as yourself. But we need it both for ourselves and for our love of our neighbor. This vaccination and doing this, I'm hopeful that we can get more yet. We're still 25% to go, maybe, right? Maybe about,
Right.
and it's. And I
What
think
are your numbers looking like in Kane County?
they're less than DuPage. I was going to show that. I think they're 51. No, 51 maybe, or 3, and you're at 61, or I forgot. I have the numbers on another site here. But anyway, it's about 10% difference. It's higher in DuPage on getting the full vaccination. So that's another sad story. We got to do better in Kane. It's about what the state average is, but DuPage is above the state average.
Yes,
Yeah.
actually, if I might, I'm not going to say boast, but if I might speak proudly of my community, we are in the top 2% of counties across the country with one of the highest vaccination rates.
You're at 61. I just looked at that. 61. This is New York Times right from today.
Uh-huh.
And I'll give you the Kane is 52. So it's almost 10% different on the vaccination front. And
Now, those are fully vaccinated.
that's fully vaccinated,
Yes.
though. That's, yeah. And I think we got to do better in Aurora and probably Elgin in Kane County. Maybe you've heard this. It's somewhat related. Maybe it is the same story. Aurora, lost 17,000 people in the census. It's hard to believe. They went from 200,000 to 180. And yeah, that's true. I don't know how this happened.
Has the population really dropped that much?
I doubt it. It means we didn't do the job, probably getting out in the community, I guess.
Mm-hmm.
So maybe that's what we got to do more yet. I know I'm working with the VNA and Kane County people on that, but we got to get those numbers up. Yeah, maybe it's similar to that. No, I don't know how he lost 17,000. It's just hard to believe.
Well, I'm going to speculate that part of that, because you have a significant Latinx population in Aurora, right?
Well, that's true. But yeah, that could be part of it. But it went from 200 in 2000.
Yeah, but the census was happening at a time when there was a lot of fear in the
Oh,
community.
no. Yeah, and they did come out with those idea that, yeah, you're right. That's part of it too, probably.
Because I actually remember people like Sherman Jenkins and others in the community who were going out, walking the streets, in fact.
Right. No, they were doing, there was a lot of things done, and but I don't think Elgin lost. That's my point. So it's sort of like, I don't know. But we're down on the numbers there and getting vaccinated. I know my friends at Kane are trying to work on that, and the VNA. Now, the VNA does do DuPage, so I can mention VNA is all over, and if anybody wants to get a vaccination and homebound, they'll come to you, the VNA. So that's really beautiful. So
and we are also pushing. I'm pretty certain that Kane County is doing the same thing, but we're also pushing or promoting, I should say.
Yeah.
The booster.
Oh, the third shot, right?
Yes,
right.
The third shot, which I've gotten mine. Okay.
Oh, really?
Yes.
I'm waiting. I think this is correct thinking till I get my tooth out in this infection that I have, to have that shot. No, I should have that anytime soon too.
Yeah,
Right.
well, I qualified to get it, so I got it.
Yeah, no, I
And
qualify. I'm just, I think my tooth thing, I just don't see that when I got an infection right now.
and
But
I'm going to give you the date. I just got something in the mail today that DuPage County, we're going to reopen our vaccine clinics
okay, where's that going to
uh,
be at?
at the fairgrounds.
Oh, at the fairgrounds.
Yes.
And are they going to be open? How many days a week they're going to be open about?
I'm trying to pull up
Okay,
I just literally got that in the mail either late yesterday evening
right.
or sometime this morning.
Yeah. Now, Kane is doing two at the Batavia site of the old Sam's Club on Randall Road in Batavia on Wednesday and Saturday.
Uh-huh.
And you can call the VNA anytime for vaccination. And yeah, I got my notice from my one pharmacy that I did get my vaccination from Meyer. So they're on top of it, these people. I'm sure Walgreens is doing the same thing, and the county too, telling people about if they have that opportunity for that third shot. Do you know, Jen, is that third shot similar to the second, or is it a little different? Is it the
It's
same?
right now, it's only the Pfizer.
Right, but is that the
Okay.
same?
I believe it's the same dosage.
That's what I'm wondering.
Yes.
I have some people who are wondering if it's different, or
No.
something.
And if I'm hoping I'm correct, but the reason that I understand it to be the third shot or booster, as some are calling it,
Right,
necessary, it's for those individuals who have comorbidities and especially who are on certain drugs like steroids
right,
or biologics, any kind of drug that weakens your body's natural immune system. A lot of your cancer treatment drugs weakens your immune system, and
right.
this is not something that, because I've heard this too. There are people who would feel like they could just take more vitamins and eat
Oh,
healthy.
don't, Jan, don't talk about vitamins. I have a cousin who was into vitamins, and I think she might be taking that horse medicine too. Oh, I don't know how to
That's
talk to
sad.
her. I don't
That's
know how to
sad.
talk to her about it even. She's
Which
and
which
she's been a dietitian at a hospital too. I go,
well, and that's why we call it resistance. This is not vaccine hesitancy anymore.
no,
This
it's
this is
something else.
resistance. Yeah.
Yeah, it's more like that. And
But someone
I
pointed out
think
to me,
that works in all communities. I think they've done a study. I think,
yes.
yeah, it's just not African American. I mean, it's all communities of races have this,
But
and
John, if
we've discussed why the African American has some different perspectives, but I mean, they're it's just bad and all around right now. We just got to beat this. Yep. What are
but
we gonna
some
say?
of this, oddly enough, is
Mhm.
because of people's religious beliefs,
Oh, that's
which
another point.
yeah,
Yes.
which is totally mind-boggling because as I recall, biblically, we as a young child, when I was, studying the Bible, we
Right.
were taught that we are to seek knowledge, we are to seek wisdom, we are to seek
Right.
understanding. So why all of a sudden we've decided that a a a a drug for livestock to treat a dewormer, which is what ivermectin is, ivermectin, whatever it's called, why we feel more comfortable taking that than a vaccine that has been thoroughly researched. Yes, things had to speed up, but it's like any war. You go in with what you have, okay? We were losing people, thousands of people a day were dying. The coronavirus science was not new. So this is a science that just simply had to be built on as they began to study for lack of a better way of putting it, the various corpse, from the what do you call it, where the coroner does this examination, as they were studying the data, they came up with, our scientists, and yes, one of the lead scientists is a Black scientist. They began to look at how to not just mitigate the disease, but how do we treat it. So they had to come up, and I think Merck announced today they have come up with a formula for to minimize hospital stays or even admissions
Right.
if you're diagnosed early enough. But this is a science that has been around for decades. This is not a new science. If we don't know about something, is it fair to say, well, because I didn't know about it, it's not new? No. I mean, we have to begin to look at this with intelligent eyes and ears, and fall back on, if we're going to rely on our biblical teachings or any other religion, fall back on, we are to seek knowledge and wisdom and understanding and make a wise decision, keeping in mind too that we are on some level our brother's keeper. So if this, and it is a contagion, if me getting this disease has the potential to harm you, John, and to harm members of my family, I want the vaccine, because not only do I want to be protected, I want to protect those around me.
Amen.
And
That's
that's just
correct.
brotherly.
And I could bring up my Martin Luther. I should send that to you, that quote I got. It's a long letter, but part of it, Martin Luther, many 500 years ago, wrote about the plague and how people were playing around with that. And he would really be upset people are playing here with this and not doing good health things. And you brought up about the past history, and one thing, some people say, oh, it's changing my DNA. That not John Hopkins article brings that up too. That's bogus. And like we said, the one lead person was an African American. I seen it on TV. I should have copied that down. The lady was very articulate about the whole situation, and she'd been involved a long time with it. You know, it's just like you said, not overnight. This stuff's not come overnight. Dan, you
Well,
want?
John, if we want to bring it closer to home, I actually have a niece who's a scientist, and she's
Right.
working on the vaccine too. I can't, for proprietary reasons, I can't give out much more information than that. But we have people working on this vaccine, and
Right.
she was vaccinated early in the process, as well as I think I can safely say now 100% of my family is vaccinated.
Well, that's very good. Yeah, that is very good. And well, we were going to talk about another topic here just briefly before time runs out here, and I'm going to bring that up here 1 second. Here, you got to get that. And one other quick thing, we got to get our youth to these clinics too. This is and we're hoping that's going to happen more for the young ones. Now we're getting approval for Pfizer for the younger ones, didn't we? Is that right? I forgot. My mind's getting blank
For
here.
the 5 to 12. Right now we have it for the 12 through 12 and up now, because we
Right.
also have it for the adults. But
Right.
Pfizer, from what I heard earlier,
Did it
Pfizer
come or
is-
not? I forgot. Is it coming, or did that
It's
happen?
coming. It's coming. They're
Okay,
expecting
Pfizer's coming in. Moderna will be after that. And
Yes.
J&J.
Pfizer they've submitted their data to the FDA, and
Right.
they're waiting for the FDA to rule on it.
Yeah. So those young ones get those vaccinations, and California is now mandating about every school or something. I mean, they're really going at it there. But they've reduced it. If you look on the New York Times website, on cases per 100,000, California is way down at the bottom.
Yeah.
I mean, down. It's a big state, and they've done some good things there. They're way down. And we're down there too. We're pretty much down there too, but we could be better yet. We're down at that bottom level.
If
Bottom
I can
third,
boast,
yeah. Mhm.
If I can boast again, I actually have a cousin who is on the governor's committee. She's actually a vice chair of one of the medical departments at USDC,
Oh,
and
okay.
she's actually out there working alongside the governor to see. My family is vested is vested in this. Okay, she's working alongside the governor to help establish guidelines, and I want to say this clearly: guidelines to protect the public.
Right.
Okay,
Right.
this is a public health emergency that requires a public health response. This is not about what I feel. This is not about what you feel. This is about what are we collectively doing to get to bring our community back into a safer place. I was not even tempted to say normal, a safer place so that
Right.
we can go out without fear of contracting a deadly disease, potentially deadly disease.
Right. Amen there. Now, Sunday, we're going to, ladies and I guess gentlemen are welcome too. But we have a special walk coming up at Cantigny and Winfield there. Uh, Explain a little about what that is briefly here about our breast cancer walk.
Well, you can see, I'm wearing my pink. Okay, this is National Breast Cancer Month, and the you're familiar with the Fox Valley Faith and Health Network, right, John?
Yes, somewhat.
Okay,
Yeah, right. Hmm.
so they are participating in a huge way in what we are calling a Making Strides Against Breast Cancer. And the walk actually began Sunday morning at Catigny Park, which is 1 South 151 Winfield Road in Wheaton, Illinois. Now, I believe I'm trying, John, you do need to sign up. I'm going to send you. Oh, did I send you a copy of the flyer, John? John, did I lose you? I'm going to send John a copy of the flyer, and anyone in his listening audience can contact John, and John will see to it that you get a copy of this flyer. But the walk starts on Sunday morning, October 3rd at 8 o'clock a.m. And I'm understanding we may have um, some rain. And my other understanding is that the walk will go on unless we have storms. And I'm hoping we don't have storms. John, did I lose you? But while we're waiting for John to return, um, I just want to point out for those of you in his audience, we've got to find a way to close the health gap. And it's not something any of us can do alone. It's going to have to be a collective effort in our community. And we're actually looking, John, I don't know what happened, but I
I
just
don't know
kept
what
talking.
happened either. I just,
Okay. But
we're back,
I'm
I
on,
think.
okay, I'm back on health equity. And the reason is we are looking for up to 10 people. We have a couple already, or a few, I should say, who would be interested in being part of a focus group. We want to talk to you, understand what your needs are, what your concerns are around the vaccine. And I'm speaking specifically to people who have not been vaccinated. And I really want to talk to you millennials, you 30 and 40-year-old, and even maybe a few 50-year-old people, because you are the moms and you are the dads, and we have children that we do not want to see become orphaned because of disinformation. And I was in a webinar about a week or so ago, and I asked the question, why is there so much disinformation um, out there? And one of the doctors responded, because we have many different streams, many social, what is it called? Social media
Right.
outlets that
Right.
people can turn into to get really bad information. And John, I guess Facebook has become the social media outlet for older people because a lot of the younger people
Oh,
are
yeah,
now
right. Right. We
TikToking.
got these other ones, Instagram, TikTok, and other things. Yeah.
Yeah, but if I can get another 7 or 8 people who are not vaccinated willing to sit down and let's have a heart to heart, because I want to understand what your concerns are. I want to know where you are getting your information from, so that we can look at giving you that opportunity to become better informed about the vaccine, and any other concerns you may have. So, John, is it okay for me to say to them, if they reach out to you, you'll get that
Yeah,
information to
we'll
me?
give that, or you give me more information. I'll do it, put it out in other ways too, besides this
Okay.
video. Well, emails and other things, Facebook more generally, and we'll give me a little breakdown or write something up real short on that, and we'll get that around. And
Okay. I appreciate
I
that.
think that's a good point. We got to find out why there's this hesitancy out there, and younger, older. I had a friend who just got vaccinated on Labor Day, so that was pretty late.
Good.
Uh, but I don't know of others right now. But I do. I know someone religious. I know one or two at my church, older. That
Well, I would love to go into some of these churches and run vaccine clinics. But
I I've tried. I'll work with you more on that. The VNAs, we're trying on that. We can get
mhm.
if you know of something, the VNA will help you too. If
Well, I've actually
or
had
the page,
meetings.
whatever you want to use. But I worked with the VNA. We're working on a retail establishment. It's been a while. It was going back and forth, but I think we're going to get a retail establishment, a barber shop to do a vaccination clinic, hopefully. Yeah.
Well,
And I've tried churches too, right?
yeah, but I think if we're able to get into some of our churches, especially the larger churches,
Right.
it may provide a safe place for people who are hesitant
Well, that's
about the
true.
vaccine.
That is a very true statement, and I would like to see more our church friends involved that way. And then on the other side, I've heard from pastors and others they don't want this thing with the vaccine. Well, we'll just back to the hesitancy part. Some ways it gets quote political, and some ministers don't want to even touch it because of quote that. So
Well, that's unfortunate.
it is
Uh,
unfortunate, and that's what's happened in the last months. I think it was earlier on, maybe it wasn't as much that way, but now it's back to that.
mhm.
And yeah, I've tried one or two churches, and that's basically what I'm getting. Basically, we don't want to touch base on it.
Well, I had as the last time we talked, we were in the middle of planning a community strong crosstown vaccine event here in
Right. I
DuPage.
remember that. It's various schools, etc. Right.
Yes, and we went across districts 203 and 204 in DuPage County,
Right.
using the
The
DuPage County.
Naperville area. Right.
Yes, medical, but well, some of DuPage County is in
Oh, it was in
Aurora.
Aurora too. One.
Yes,
Yeah.
because we were at Wabanzi
Yeah, you were
Valley,
in
and we were
Matea.
at Nequa. No,
I
not
think.
Matea, not
No,
Nequa, because
Matea.
Nequa's,
You were at
yeah,
Matea.
Nequa's in Will County. But I mean, this actually brought me to tears. I got a private message from a couple who thanked me for my role
Oh,
in
really?
planning the vaccine clinics, because she and her husband went over and got their vaccines.
Oh, nice.
But I could tell from the way that she sent it that this was something she did not want her friends or neighbors to know. And I'm okay
Really?
with that. I would never divulge her name. I'm okay with
No,
that.
right. But
Yeah.
wow, that's That is true somewhat too. I think some of my friends maybe don't want to tell their parents or that they got the vaccine. I think that's true for some
So,
reason.
yeah.
And
But I think someone said to me yesterday, I think our next big fight is mandates. And that may be it. But you know what I thought about, John? And granted, it's not anything going into my body. Seat belts are mandated,
right,
okay?
right.
And that was a public health policy.
It was. That was the impetus for that.
Right.
It was more or less helping you and your loved
Stay
ones.
safe.
Right. It wasn't so much maybe others, but that was definitely to help you and those in that
But
car
think
with
about
you. Oh, well, the
think about
others would be those in the car with you.
yeah.
Yes. And
But think about polio.
oh, definitely that was
There was
that way. And
there was a
I
time.
don't remember any resistance on that. I
Yeah.
don't.
But we didn't
Maybe
have
there
social media.
was, but I don't remember it.
Yeah, but we didn't have social media.
Well,
And
that's true also.
we didn't have political leaders making it a political hotball or hot potato. I'm not good with these adages. But think
I
about
agree with you on that.
yeah. But
It's
think about measles. Think about what is that? Rubella. Think about chickenpox. These are all diseases that at one time in our history were diseases that resulted in death
right,
or resulted in more sickness.
right,
And in some cases, especially with polio, there were many cases that it resulted in lifetime physical disabilities.
right.
These are diseases that were cured by vaccines.
That's correct.
COVID
Yes,
is one of those diseases that we can cure by vaccine.
that's right. That's right. Well, we've had a good, lengthy conversation here, and we're going to pass this around. This little dialogue. I think we've had a good conversation on what's happening out there with Jan, and we're just going to try to get more people get that vaccination, get that jab, and get that third jab if you're in that situation. And so I just again want to thank Jan for coming by, and if you can, I put up that link. It's not great here, but we have a link there on that coming up time here at the park here.
Oh, thank you.
That's coming up on Saturday. I put that around on
No, no, no.
Facebook.
Sunday
I
morning.
mean Sunday. Excuse me. Yeah, too many weekend things thinking here. Yeah, that's Sunday in the morning at Catigny. So that's great. And so I thank Jan for coming by here and visiting with us again. And she's been really striving to work ahead in the community there, and I appreciate her diligence there. And this week has been a week of COVID. I had the Kane County Health Department on Monday. We had VNA on Wednesday, and with Sunny Dirama, and then today we have Jan. So it's just a blessing. We're just trying to build that up because it's the love of God. We're trying to reach out people with, as Pope Francis said, we're trying to love others here with doing this type of outreach.
And
Yeah.
John, if I might just say this last thing, life is a wonderful gift. How we wrap it is with good health and making wise decisions to stay healthy, to live healthy. So just keep that in mind. And again, we are not judging anyone. We want to understand, though, what your resistance is so that we can uh, better help all of us. So I will send the information to John to reach me if you're interested in being part of a focus group to just share with us in a non judgmental environment what your concerns are that keep you saying no to this vaccine because we all want to live. I think I can speak for both of us, John, right?
I think so. I think that's a good statement. Yeah. Uh, even a Christian wants to live as long as the Lord has time for us, and I know He gives us wisdom. So He's telling us to do the vaccination. I believe that totally, and He wants us to share that with others. So Monday, we don't know what that's going to hold, but we're going to be back on Monday at 5. So just want to remind you that. So again, Jan, thank you so much for coming by and visiting, and we love this time together. And yes, give me that information and we'll pass it on, and we'll work with Faith there, Faith Nugent also, and we'll just we want to know why some of you out there are hesitant, and we want to get everybody to have that vaccination and have good health. So thank you again, Jan, for being
Thank
with
you,
us.
John.
And so we'll just say right now, God bless everybody out there, and bye-bye there, and we'll see you Monday, Lord willing.